Hello and welcome to this latest update for the Dorset Care Record for summer 2022. Thank you for joining. So today's short presentation will basically look at some of the history and our partners with the Dorset Care Record. It'll touch on some of the benefits that we've been accruing. We'll have a look at what's in the Dorset Care Record for each of our partners, and then touch on what's coming up next in the next few months. Then a quick look at the facts and stats in terms of our users and what they're using it for. And then just finishing off some training requirements that we ask our partners, health and social care professionals, to undertake. So let's kick off with what is Dorset Care Record. So every single ICS, integrated care system, has to have a health and social care record. And we started ours back in March 2018. So we're not the most mature. Hampshire, in our neighbouring county, has been going for nearly 20 years now and has a considerable number of users. About 180,000 records are accessed every month. As we'll see later, we're a little bit further down the line, but we're around about the 75,000 mark. We are more mature than some of the other counties. So Devon and Cornwall are just about to start theirs. Somerset Cider scheme is up and running, a little bit behind us, but not by much. The whole point really of the Dorset Care Record is to provide a consolidated view of information from right across the health and social care systems in the county, and that basically enables information about person's medical records to be summarised in the same place. So it improves the care of people in Dorset. Just a few words about our partner organisations. So we have our two acutes, University Hospitals Dorset, that used to be RBCH, Royal Bournemouth and Christchurch Hospitals, and Poole Hospital, put together into UHD, and then Dorset County Hospital at Dorchester. All the 71 GP practices in Dorset, part of the NHS Dorset Clinical Commissioning Group, are partners. And then there's the community mental health provider, Dorset Healthcare University Foundation Trust, and the two local councils, Bournemouth, Christchurch and Poole and Dorset. Then we have some secondary partners who joined back in 2020 at the start of COVID. So that includes community pharmacies in Dorset who have found information about discharge medications and allergies particularly useful, and Yeovil Hospital, who take a large proportion of North Dorset patients over the border in Somerset. Then we also have working with some tertiary partners. So these are partners basically who work closely with or contracted to work with some of our core partners. So people like Help and Care. We're in talks with Wellmore Hospice, Avon Wiltshire Mental Health Partnership, Salisbury Hospital. So some of these are live and some of these are still in negotiation dialogue. So as you can see, we're expanding quite nicely. We're often asked about the benefits of the Dorset Care Record, and I wanted just to touch on these. So when I first started working on the Dorset Care Record, there were lots of stories and case studies about individuals working for one partner, having to fax information or ring up or even use paper-based systems to try and find out information. Quite often, if they were asking, for instance, a GP practice manager was away, the answer was sorry, she's the only one who can provide you with the information, come back in a week's time, which meant that people were going out to see patients without the full information. So quicker access to better information 24/7, and that's really important. And obviously that leads to better experience and outcomes for service users, with patients not having to repeat their story, only having to tell their story once. So continuity of care is really important, and a greater understanding right across the system about patient welfare. So what's in the Dorset Care Record at the moment and what's coming up? So in the DCIs, you can see that the acute hospitals have been kind of leading the way. Dorset County Hospital has now fulfilled all its initial obligations. University Hospitals Dorset is slightly further behind. We are working on a spec with them at the moment around pathology, which would be great to get that in, and discharge medication slightly further behind. Dorset Healthcare, we're in talks with them around alerts and referrals to start in the autumn. and we've just been given the go-ahead for Dorset Council around their adult alerts. And as I said earlier, I think all GP practices are involved in the Dorset Care Record. So becoming more mature, which is great, and we've just recently added eDocs, maternity eDocs from Dorset County Hospital. So about 1,500 additional files, bits of information going into the DCR. So we are still growing, but still some way to go with the local authorities. So I just wanted to touch on stats again. We've grown considerably, as you can see from these graphs. So back in April 2019, we were hardly on the graph at all. But figures for March were very encouraging. We saw 76,000 patient records viewed. That was up 14% on February figures. And as you can see, single sign-on, so going straight from the electronic patient record to the Dorset Care Record at a touch of a button, proving really popular. 59,000 compared to 11,500 going through the portal system, through the web system. So if you take that into account, we were talking about nearly 2,500 daily accesses to the care record. And there you can see in the slide, one of the slides, that pathology reports particularly are proving very, very popular, and radiology also increasing. So just a little bit around mandatory training. So when we moved from belt and braces consent approach to discussion to view, the Information Commissioner's Office was keen for us to carry out some mandatory training for our health and social care professionals around that. And so we provide a very quick module really for them, basically looking at what's in the DCR, so some of the history that I've just been talking about. Discussion to view, when to have the discussion to view, so clearly not when someone is unconscious, having arrived in acute hospital ED on a Friday evening, but during the care along the journey of a patient. So that might be at a doctor's surgery, it could be further along the line. Then we also have a look at sensitive records and what to do regarding breaking a seal. Opting out. So opting out, we have about 2,500 people who have opted out of the Dorset Care Record, and it really kind of tells people what to do if someone comes to them and says, look, I want to opt out. And it's important for them to know that if they want to opt out of the Dorset Care Record, they need to opt out of the summary care record and vice versa. So if they don't want their records to be looked at. And then there's something around appropriate use of the DCR in terms of security, and there's some multiple choice questions at the end, an assessment that requires 100% pass. And we've had about 4,200 people so far from across our partners who have completed this, which is great. I just really wanted to end on this slide, which we commissioned from someone at Dorset Council to do this drawing, and I think it's quite fun, but it also looks at how the Dorset Care Record is working right across social care and health. So it includes social workers, the links with pharmacists and GPs, the links with acute hospitals, but also the links with My Dorset Care Record, the patient portal, the individual. And we're just carrying out some exciting pilots at the moment for the patient portal, and we hope to draw those to a close at the end of June, beginning of July, and then probably through with consultants, then requesting patients to join in terms of beginning to roll out the My Dorset Care Record. So some exciting times, and I hope that's been helpful. Thank you.